name is Indiana Sakona. I'm a student nurse practitioner at Auburn. This is going to be my suture demonstration video. I have a patient who came in here with a laceration to his forearm. Initially, I want to evaluate the wound. I want to know the mechanism of injury, how old the wound is. I can close anything up to 18 hours in the extremity. If it's the face, I have up to 24 hours, and that's per up to date. I want to assess contamination level. I want to understand if there's a possibility that there's a foreign body embedded somewhere, and if so, I would get an x-ray. I want to evaluate the size and the depth of this wound, and then injury to any other structures, especially joints, nerves, and tendons. I want to assess the patient for tetanus prophylaxis. When was the last tetanus vaccine? And then I also want to assess the risk of impaired wound healing. Does this patient have diabetes or some sort of clotting disorder or anything like that? Wound prep. So this is an acute minor wound. That means that it does not involve the joint, nerves, tendons, or any underlying structures. Initially, I want to achieve hemostasis. I can do that with direct pressure. Sometimes the lidocaine with epinephrine can be instilled into the wound. Gel foam tourniquet is another option, but that's not always recommended. In some cases, debridement may be needed. I can do that mechanical debridement, or I can do it with irrigation. Hair removal is not necessary unless it's going to impact the closure of the wound. And then irrigation, one of the most important things, I want to irrigate with copious amounts of liquid. Normal saline is fine, sometimes 1 to 10 betadine. Some people say tap water works as well. I want to irrigate at about 5 to 8 psi. You can do that with a 19 gauge 60 cc syringe, and using up to 500 cc's of normal saline or fluid is not unheard of depending on what the wound is. Next, we'll talk about anesthesia. A topical option is called LET, and that's a topical solution that you place 3 cc's on a cotton swab or something like that, and put it on the area that you're going to anesthetize and place a cover over it. That takes about 20 to 30 minutes to work because LET has lidocaine, epi, and tetracaine in it. You cannot use it on fingers, toes, penis, ears, nose, or mucosa because of that epinephrine. Most often though, people use local anesthesia to infiltrate the wound edges. LET can be used if you have a superficial wound or something that only requires 1 or 2 sutures. Local anesthesia, most often that's used, is going to be lidocaine. That comes with or without epi. The onset is about 2 to 5 minutes. If you use the one with epi, it does last a little bit longer, but again, it's contraindicated in those areas that are prone to necrosis, like fingers, toes, penis, ears, nose, and mucosa. There's a longer acting type of local anesthetic that lasts about 240 to 480 minutes. And in some cases, you can mix the two to get a little bit of both worlds. So to instill my local anesthetic, I would want to cleanse the area, however is indicated. Chlorhexidine, iodine, something to sterilize the area. I can instill a couple drops of lidocaine or anesthetic on the inside to kind of start the process. And then I would inject in a systematic fashion to make sure that all the area around where I'm going to suture is anesthetized, paying attention to my corners. So if I inject here, then I want to inject kind of where bifurcated and inject into starting where I've already, my fluid has already been. So I want to go around, understanding that instilling lidocaine, because it's a fluid that's infiltrating under the skin, that you can have some changes in structure, and just understand that it can kind of change your markings around. Next, we can talk about wound care. In some cases, patients will go home on PO and topical antibiotics. If there's drainage after closure, you can use a gauze with a bandage over the top. If there's no drainage, something like a Tegaderm may work. But either way, they want to keep it in place for 24 hours. Bathing, for a non-absorbable suture, they can bathe after 24 hours after repair, and they can clean the area with gentle soap and water. If it is an absorbable suture, they need to keep it covered for 7 to 10 days and not expose it to water. There is no swimming at all. Removal, they need to come back in 5 days if it's the face. Scalp is about 7 to 10 days. In this case, it's an upper extremity. I would want him to come back in 7 days for suture removal. Lower extremities are 8 to 10. Digits, palms, and soles are 10 to 14 days. If anybody's high risk, so an animal or human bite, diabetes, anything that's going to impair healing, or if they have an increased risk of infection, I do want them to come back in 48 to 72 hours. I would also talk to my patient about when to come back sooner or go to the ER if they are experiencing signs of infection. So any heat, edema, induration, fever, they do need to come back. Several types of sutures are available. Example of a absorbable suture is a vicryl or a monocryl, and those are going to absorb into the skin. They require 3 throws to put in. This is a non-absorbable. It requires 5 throws. This is a nylon monofilament, and I'm just taking the memory out of it right now so that I can use it. And this would all be sterile, and I would have sterile gloves on if I had access to those at my house. So these do handle better. They're visible in the skin, so when it comes time to remove, they're very easy to see. And they handle better stretching and edema that occurs naturally. As far as size, the larger the size, more inflammation, so we do want to be aware of that. As far as what size you use where in the face, you can use anything from a 5/0 to a 6/0. Forehead or digits, same thing. If it's a scalp, trunk, or extremities, 3/0 to a 5/0. And if it's something under tension, 3/0 to 4/0 works great. So I have my suture here ready to go. My patient has been anesthetized, and I made sure that he couldn't feel anything. So I'm gonna go ahead and start suturing. I have my needle here, and I do wanna put it in at a 90-degree angle. If I were closing this whole wound, I would start in the middle and then cut them all in half to make sure that the edges were well approximated all throughout. But for the purposes of this, I only need 5 sutures, so I'm gonna start at the top. So entering in at 90 degrees and then following the curvature of the needle. What that does, it gives a beautiful box shape to my suture instead of a diamond shape. So my healing will be much better and the wound edges will be approximated much better. All right. So I prefer the over-under technique. And like I said, these do require 5 throws to stay in place. I also want to make sure that all my knots are on the same side. I think that was 5. And then I do want to make sure that these are nicely trimmed. And then holding it a little bit closer. I don't want to hold my needle at the tip because that'll bend it. And then just doing my best to make sure that they are evenly spaced. And again, I'm following the curvature of the needle to get that 90-degree, to get that box shape. Okay. So 1, 2, 3, 4, 5. 1, 2, 3, oops, 3, 4, and 5, one, 2, 3, 4, and 5. Again, entering at 90, following the curve. One, 2, 3, 4, and 5. And also I want to work towards myself and not away from myself. That helps as well. And then one more. Also want to make sure that I'm closing everything I need to close and not just picking up the epidermis. That's 3, 4, and 5. And again, just make sure that they're all on the same side.